Nick, I think about all the information that's being collected and making sure that it's being done securely, efficiently, readily available, immediately able to be retrieved, et cetera. Tell us what's happening at Pure Storage. I'm sure that you all are just really going guns a-blazing here in regards to enabling these capabilities.
You're absolutely right. So sort of as the wholesale data custodians in an architecture, the data service platforms and Pure Storage particularly have focused tremendously on how do we protect the data. Throughout the pandemic, patient records, hospital systems have become tremendously popular targets for ransomware, as an example. The questions that we present ourselves is, since we have tremendous quantities of patient information and of course disease and epidemiology information, how do we facilitate technologies within our systems to protect patient data? So we've integrated a tremendous amount of technologies that help us create immutable and impermeable data components, the patient records themselves, to ensure that they are relatively immune to tampering or to crypto locking. And the other thing that we've done is focus a tremendous amount of energy on how do we restore data as quickly as possible. And I'm not talking about a couple of hundred, even a couple of million files, like terabytes per minute. So in the event that we have to bring data back out of escrow or restore it quickly, we can do so in a user meaningful period of time. So if we can bring back, several hundred terabytes worth of data within, an hour, that's tremendously beneficial. I should say several hundred terabytes would take a couple of hours, but that's still tremendously beneficial for an organization to get themselves back in operation as quickly as possible. I think the second thing that we've done, if I can touch on it very quickly, is we partnered with the National Institute of Health and the Centers for Disease Control last year, particularly at the outbreak of the pandemic, and then of course as our understanding of the disease evolved. Being able to process that data, collect that data, make that data available as quickly as possible, as widely as possible to the life sciences community, was essential in helping us wrap our arms around what was SARS-CoV-2 and how did it behave. So the ability to continually allow researchers and policymakers to understand the disease itself and its spread and evolution was something that we were very proud to be able to partner with and be a part of. So those are probably our two biggest components: is data protection, and then the data analytics and research, data availability, and data mobility that support the sort of widespread whole of government efforts to support the health of our citizens.